America, there's almost 3 million people addicted to opiates, and Broward County is no exception.
In 2017, approximately 72,000 people died of overdoses. The reason that people are dying dates back to when oxycodone was approved and considered to be a non-addictive substance. And unfortunately, people became addicted.
I'd like to welcome you here this evening.
We're having a workshop for the public on the opioid crisis. We also tonight are speaking with Memorial Healthcare.
What treatment options are available and how are they different than, let's say, 10 years ago?
And having them as a partner is an excellent way for us to reach out to the public.
We started clamping down on opioids, and so now we had patients that were addicted to opioids. What do they turn to?
Heroin. And then the drug dealers started cutting heroin using fentanyl.
Fentanyl is a drug 1,000 times as potent as heroin, which is cheap, synthetic. It's mixed in with the drug supply and sold to people out on the street without any awareness of what they're buying.
Because of the opioid crisis, grant dollars have been made available here in Broward County so that people, regardless of their ability to pay, can have access to treatment.
If you're using heroin and suddenly stop breathing from an overdose, Narcan can immediately reverse the effects of heroin and potentially save somebody's lives.
And we, of course, try to talk to the patient about engaging in treatment by being a part of medication-assisted treatment, which essentially is using buprenorphine as a medication to help stabilize the individual and reduce their cravings. If an individual goes through the process of being detoxified, once they leave the structured treatment environment, they often experience strong cravings. Vivitrol is a long-acting medication that, for people that want to maintain abstinence, lasts for approximately a month. So if they get a Vivitrol injection, if they go to use an opioid and/or drink alcohol, they get no effects of a high. If individuals can stay drug-free somewhere around 8 to 12 months, their ability to sustain recovery for a longer term significantly increases. Some patients need more than outpatient medication-assisted treatment. Oftentimes it's because they're also addicted to other drugs, such as alcohol. So people need a more structured inpatient program, and we have that at Memorial Hospital Pembroke as an option.
Very nice, very nice.
This setting allows them to come in and receive medical treatment to prevent adverse reactions to their withdrawal symptoms and really get them prepared to go on their next step of the journey, which focuses on the counseling side of things.
It's really important to get into a behavioral treatment program. In addition to medication, there's peer specialists, behavioral therapy, antidepressants, and other things that patients really need. And the peer specialists are typically recovering addicts who are now sober and out there to help other patients.
When you look at your scars now, what do you think about?
Now, when I look, I'm actually grateful because it is a daily reminder for me of what I went through, what I did to myself through my choices, why I don't want to go back to that. I get to tell people my story, and hopefully I can point them in the right direction so they can change.
The peer specialist provides the psychological support for these patients. At the same time, we provide the medication to control the craving and the addiction.
If you've ever heard a baby cry in the throes of addiction, it's very painful and it's very sad. So in 2015, we started a program called Mothers in Recovery. We wanted to give women that had opioid use disorders the opportunity to detoxify and deliver their babies drug-free. And we've had 94 births, and 88 of those births, the babies have been born drug-free, or a 93% success rate. Because of the medication-assisted treatment program, the Vivitrol program, the Mothers in Recovery program, I know it's made a big difference for our healthcare providers here in our emergency department because now they feel like they have an option.